Welcome to the final segment under Lifespan Development, entitled Late Adulthood. This is Keith Whitmire with Wayne County EMS. Alright, let's begin here. Maximum life expectancy is the oldest age to which any person lives. Currently, maximum life expectancy for humans is about 120 years. Average life expectancy of is the age at which half of the people born in a particular year will have died. It's an approximation. That's just exactly what it says. Average. They'll add everybody's year, add up however old everybody was this year when they died, divide it by however many people they got, and that's how they'll get the average. In 2004, a baby born in the United States had an average life expectancy of 77.9 years. Alright, changes in the respiratory system include diminished elasticity of the diaphragm and weakening of the chest wall muscles. Coughing is ineffective because of weakened expiratory muscles. Damage or loss of the elastic fibers of the small airways and thickening of the alveoli results in decreased number of alveoli that participate in gas exchange. The activity of the cilia in the lungs is decreased, which results in an increased collection of mucus in the respiratory tract and an increased susceptibility to infection. Alright, sensory changes that occur in this population include a loss of taste buds, hearing loss, diminished sense of smell, diminished vision, diminished perception of pain, and diminished reaction time. Older adults have less subcutaneous tissue, inefficient blood vessel constriction, diminished shivering and sweating, diminished perception of temperature, and diminished thirst perception. These factors increase in older adults' likelihood of experiencing a heat or cold-related emergency. Older adults experience a loss of muscle strength and decrease in the number of muscle cells. Regular exercise can help slow the process. Older adults also experience a loss of bone mass. Bone loss is greater in women, particularly after the onset of menopause. Falls are common in adults. They occur because of vision and/or balance problems, physical weakness, environmental hazards such as poor lighting and throw rugs, urinary problems, or the effect of taking multiple medications. In the urinary system of some adults, blood flow to the kidneys is reduced because of thickening of the blood vessels and subsequent narrowing of the renal arteries. The amount of urine the bladder holds decreases with age, and the need to urinate becomes more frequent. As a result, older adults often arise during the night to urinate. You'll see this being a large reason a major reason why we end up getting called in the middle of the night for falls. Many changes occur in the adult's GI system. Some older adults have no teeth and depend on dentures. Many have dentures but do not wear them. Others cannot afford to purchase them. The amount of saliva normally present in the mouth declines with age. Loss of smooth muscle in the stomach causes a delay emptying time. GI secretions are decreased. Liver blood flow is decreased, resulting in less efficient breakdown of protein. A decrease in pancreatic secretions results in less efficient breakdown of fats. Impaired absorption. B. Calcium and iron can cause vitamin and mineral deficiencies. In the nervous system, there is a loss of nerve cells, which can result in memory impairment. Older adults are able to learn new material but have difficulty retrieving information. Balance and coordination are decreased. Sleep disorders are common in older adults, and most adults feel drowsy more often in the daytime, take more naps, take longer time to fall asleep, and spend less time in deep sleep and wake up more often. Some cognitive abilities decline with aging, while others remain stable or improve. Short-term memory, which is what a person has in mind at any given moment, such as remembering a phone number long enough to dial it, is relatively unaffected in older patients. Age-related changes in memory most often occur in recent memory. Recent memory is that which is used every day, such as information pertaining to current events or a recently read article. Long-term memory, such as memories of childhood friends and events, is essentially unaffected by the aging process. In addition to adjusting to decreasing physical strength and health, older adults face many psychosocial changes, which include making personal choices to find the meaning of life, evaluation of one's self-worth, adjusting to retirement, adjusting to reduced income, establishing satisfactory living arrangements, adjusting to the death of a spouse or companion, maintaining contact with friends and family, and meeting social and civic obligations such as through volunteering and political activities. When communicating with an older adult, obtain a history from the patient, speaking to him or her in a respectful, friendly manner. Elderspeak should be avoided. Elderspeak, often unknowingly used by young adults when speaking to an older adult, is a style of speech that resembles baby talk and contains the following features: speaking louder and more slowly, using a patronizing tone, high pitch, increased volume, increased repetition, simple vocabulary and grammar that compared to normal adult speech, making statements that sound like questions and exaggerating words. Elderspeak does not communicate appropriate respect. Its use implies that older adults are dependent and incompetent, lacking the ability to understand and respond. The use of elderspeak when talking with an adult can cause confusion and decrease comprehension. For example, speaking too slowly can affect an older adult's ability to focus on the main point you are trying to make. It's also hard to understand a statement that sounds like a question. Exaggerating words can cause confusion. Slow speech, shortened sentences, and using simple vocabulary sounds like baby talk and is perceived by most older adults as demeaning. An older adult will better understand you if you repeat and reword what you are saying.